Hello, it's Dr. Pat with Little Critters, and we have Lola with us today, a 15-month-old Holland Lop adopted from rescue. And she's gotten a wonderful, loving home, which this darling little girl deserves. And they're taking great care of her. She is spayed already, but today we're going to cover the 10 things or 10 questions you should ask your veterinarian before your rabbit is spayed. So it's very important that when you have any surgery on a rabbit, it's done by a veterinarian that's very experienced in rabbit care, anesthesia, and surgery. Rabbits are very different than dogs and cats. Procedures on them are different, their medical needs, their stresses and pain tolerances, all very different than what a typical dog and cat would see. So we just have a list of questions that we think are important that you can use if you're in another state and not able to get over here. Then just ask your doctor a few questions. The good doctors are going to want to answer them, and they're going to be proud of the care they provide and happy to discuss it. So number one, how much rabbit experience do they have? How many rabbits do they see a day? We typically see anywhere from 5 to 10 rabbits every day. Numbers and experience are important. They make a difference. You see and learn things over years of experience, not days of experience. So ask about numbers. Do they do pre-surgical blood work? This is important for any animal that has surgery, including people. But we want to make sure, particularly for an elective procedure, which means it's a healthy patient going into the procedure, that we have very healthy animals so we have the best possible outcome. And if there's a problem, a kidney problem, a liver problem, that should be addressed before going under anesthesia. And the only way we know that is if we can check a metabolic panel and make sure everything's okay. Some doctors that aren't as comfortable with rabbits may not routinely be comfortable with blood draws on them. It is a very straightforward process though, and really easy to learn, so it's a question that should be asked. And then comprehensive pain control. Rabbits are what we would call a prey species. And what that means is if they're being chased or exposed to danger in the wild, they're often at risk of being eaten. And so even little stressors in rabbits can be a very big deal. And stress in rabbits can result in GI stasis, which is kind of like colic in a horse. And stasis is basically where their GI tract shuts down. It's very common in rabbits. We see it pretty much every day. And so the preemptive pain control, or the pain control done during and after surgery to prevent stress and prevent stasis, are very important. And so it's not a matter of just doing surgery and sending them home. We actually give pain injections and pain medication before we do anything, so they're comfortable before we even get to that point. And every rabbit patient goes home on pretty significant pain control to make sure there's no discomfort and they rebound and are back to normal day one. So ask about what they do and how they do it. It's a good, reasonable question. And then dedicated nurse monitoring. Again, important for all animals, vitally important for exotic animals. In exotic animals, values and vitals can change on the drop of a penny. So we watch very carefully to make sure that the heart rate is staying steady, that the blood oxygen levels are staying up, the depth of anesthetic is important. And typically in veterinary hospitals, the pet nurse is the one doing the anesthesia. And these nurses need to be trained in exotics, experienced in exotic anesthesia, and knowing what to look for. And a really well-trained exotic pet nurse is worth their weight in gold. They can make a life-saving difference. So ask about their experience as well. And then exotic-specific equipment, not something we would most commonly think to ask, and as an owner, you probably haven't been exposed to the equipment that's needed, but it is an important question. In rabbits, because they have this little face with an airway way back here and a tiny little mouth opening, you can't open their mouth and see the opening to their airway. What that means is getting a breathing tube into their airway is much more difficult than a dog and cat because you can't visualize it. That's called an endotracheal tube when we put the tube in the airway. The tube is important because it controls the airway. What that means is you have control of respiration or breathing during anesthesia. And this often requires specialized equipment. We actually use an endoscope where you can actually put the scope in the mouth, see the airway, slide the tube in. It's very stress-free and very quick. In a practice that rarely does rabbits, they're probably not going to have that, and they may just do a face mask, which does not provide any airway control. So ask about airway control. And then IV catheter and fluids. So just like your dogs and cats or people, an IV catheter should be put in the arm or the leg. We usually put it in the back leg. and that gives vascular control. You can give pain medicines or anesthetics as needed at the moment, and if there's any kind of life-threatening event, you have access or venous access to be able to control that. So it's an emergency prep procedure that's important. And then surgical monitoring or post-surgical monitoring is also very important. And that means after surgery, what is being done? Is the surgery done and then the animal's just placed in a cage and left? In these days and ages, hopefully that's not happening, but it's worth asking. Our typical protocol after a rabbit surgery is they're put in an incubator and they're on a timer with vitals taken every 5 minutes until we deem them appropriate to come out of the incubator. And then as soon as their vitals are 100%, because the temperature will drop a little bit during surgery, so we want it back up to normal. Once it's perfectly normal, then we start syringe feeding, and we feed while they're here that day. And again, this is to prevent stasis, and that's very important. And then internal sutures only. So some people will use external sutures on exotics. I almost always use all internal sutures. And because we use internal sutures, we don't have to use an e-collar or anything to prevent them from going after them, because the sutures are kind of folded under the skin and not seen by the rabbit. And so they're not bothered by them. They don't have to be restricted at all. And then obviously a very important point is, what's the doctor's experience in doing surgery on rabbits? And again, a doctor that's confident and has done a lot of these will be happy to talk to you about it. And so always ask about their experience and skill level. And then as far as go home and what you can do, this is just a side point. Our rabbits go home, as I said, without any type of collar. They are on pain medicine. We don't restrict their movement. We allow them to move normally after surgery, and actually like just regular movement because it kind of encourages the GI tract to move. And so the big thing we do is just have you watch that they're eating and pooping to make sure no stasis occur and give them meds. And that's really it. So rabbit surgery can be done very safely and very effectively, and a spay is vitally important in female rabbits because about 60% of them will develop cancer. But we want to make sure it is safe for them, and we do that with knowledge. And so hopefully this helps. And we just used her because it doesn't get much cuter than this. So we wanted to get a video of this little love bug who just got rescued and got a forever home.